Podcast is now starting. All attendees are in listen-only mode.
Hi, everyone. So we're going to go ahead and get started. This is Rebecca with the Washington Food Industry Association. And I just wanted to start out with a little bit of housekeeping with the questions. If you're at your computer and you know you're going to want to ask a question, you can either do the hand raising, and we'll get to it at the end, or you can use the chat feature. Over at the side, it says questions, and you can type your question in there. And we have Jan with us, who is going to go ahead and get started.
Good afternoon, everybody, and thanks for attending our first COVID-19 webinar. We plan them right now for weekly webinars, but if the need arises as the information flows, we will definitely have them more often. But I do want you to know that we are on the hour every hour, keeping our website up to date, and every time we get something from either federal, state, or local governments, we plug it into our website. Melissa is a manager of a website, done a great job, and we have started a new box today because we're getting so much information in that says new today. So you'll be able to go in, so you don't have to dig through and read all the other information that you already read. Just look at new today, and then each day we'll refresh that. Rebecca, could you please put the website up where with the boxes on it is? Oh, sorry, she did. She's got it there. So you can see the different boxes. Melissa is going to attempt to see if we can put a spot up there that you can ask questions directly on this site as questions arise to you that myself or somebody else on our staff can answer for you or go find the answer for you. So today is to familiarize you with where we are today, what information we have. We've been participating every day on federal and state calls, and we'll get you up to date on that. We're going to open it obviously for Q&A. We've got to mute you for now, but we'll open it up and just ask that if you're not talking, please keep your phones on mute so we can hear. And I've been talking to many of our retailers and suppliers, and I've asked 3 of our retailers today to just take a few minutes and share their best practices, ideas that may help some of our other members. So I would like to remind everybody on the call that we always operate under the antitrust laws, and there will be no discussion of prices or allowances, credit terms, quality rate, any of that sort, or what suppliers can do what for you. And the antitrust violations are very significant, and we want to protect you as well as the association. Lots is going on. In fact, I'm trying to keep my notes so that I can make sure you all know, but I think directly, first of all, for our trucks, we were having a barrier on the hours of service, and our state was the first state to jump onto that with the help of Congresswoman Cathy McMorris Rodgers. And we did get a federal waiver on the hours of service. Excellent news, and it is posted on there. You must have your truck driver make a copy of that and have your truck driver have that letter with them. Also, we were asked about weight exemptions, but we find out that our state has the most liberal weight allowance on trucks, 105,000 pounds. So you're good to go. We don't need that. And we are getting daily more and more local governments that are waiving the late night noise penalties on you, so that because I know that you don't have enough drivers, you're having a hard time keeping up with it, that you'll be able to do late night deliveries. So far, we have Snohomish County, Seattle, and Pierce County, and we're expecting many more to come in. Yesterday, as you know, the restaurants, eating establishments were told to close down except for to-go foods. My discussion with the Department of Health is, do those seating areas, do you consider us restaurants? They had not made a decision on that yet, but many of our stores just took it upon themselves to shut it down. Our stores are doing everything they can to respond to keep the public safe. The Department of Health thought they would get the policy paper to me before this call today, but they did not. But I feel 99% sure they're going to say, no, we cannot have any sit-down eating areas open. All foods have to be to go. The other thing that we have worked on, we immediately got a waiver from our state Department of Health on WIC inventories because we were getting comments from some of our grocers that they were having a hard time getting enough supply to stay up with the inventory. So our state jumped right on it and waived no inspections on your WIC inventory, and most of the states have applied to the feds to go ahead and allow substitutions and a permanent during COVID-19 waiver on inventory requirements. I was just on a national call a few minutes ago, and it sounds like they are very, very close to issuing the federal response to that. We'll make sure that it gets posted immediately also. We are, as it is explained to me by the emergency response and Department of Commerce, who I'm interfacing with multiple times during the day, that there are 13 steps in an emergency response to the pandemic as we're experiencing right now. We are currently at step 11. The governor has already announced that he will be holding another press announcement tomorrow. And although I had nothing in writing and a vague kind of trying to work around the response, when I asked the Emergency Response Division of the military, are we going to move to level 12 tomorrow? I feel very certain that is what's going to be in the press conference's announcement, that we're moving to level 12. What level 12 does is tells everybody to stay home, hunker down. There will be no travel except to the grocery store, the pharmacy, or health facilities. So in essence, it's going to be what they have indicated as being mandatory workers to keep our state running. This exemption will also include any of our trucks that are delivering anything we need in our grocery stores to keep the doors open and keep operating. So essential workers, it's going to really shut our state down at level 12. Not as bad as Northern Italy, that's step 11, but it will be a significant change from where we are right now. I have been in discussions for the last 2 days with Employment Security and the Hospitality Association after the announcement came out yesterday that the restaurants were closing, I said, our stores need people that already have their food health card. And we also need people in our stores that can help keep things clean, the carts, the counters, everything clean, because the cleaning process is, if it's triple, that isn't even enough. So the Hospitality Association is putting up their site today that will tell their laid off employees to go to their nearest neighborhood grocer. And Employment Security is putting a conference call together with us either later this afternoon or tomorrow. It sounds like Employment Security will also put up a site just for the hospitality industry and the grocery industry to match those laid off workers with our industry. And as that gets developed and useful, I will make sure that we get that information out to you. I think one of the things that I am really, really going to stress is if step 12 takes place tomorrow or the next day, whenever, it is so incumbent on us to make sure, since everything else will be closed down, but healthcare, and well, banks, you'll be able to go through drive-thrus, but that we really step up to the challenge of keeping those carts clean, those checkout stands, encouraging our customers to keep the 6-foot distance. I was asked yesterday if we would be okay if the Department of Health applied the 6-foot distance to our stores or occupancy limits. And I said, only if you have the National Guard or local law enforcement at our doors controlling it, because things are very emotional right now with our customers. And they said, well, they would be getting back to me. I'm hoping in this memo I'm supposed to be getting on the other information, I'm hoping that they will also have something there. But I know some of our stores have already taken steps on their own, and I've asked Kevin Weatherall to share that, and they've sent me their best practices, which we have put up on the website there for you all, that you would look at how you can encourage your customers to keep that 6-foot distance, because we would rather do it voluntarily and what works for our customers in our stores rather than have it mandated on us. I think I forgot to mention the salad bars. I'm not sure. Maybe I did. There's so much going on. We also expect a directive that will require us to shut down our self-serve salad and hot bars, and that everything will need to be dished up by the employees behind the counter. This is another reason that I contacted the Hospitality Association yesterday, was anticipating that you're going to need more help in the deli with this. I'm just scanning my notes here. What I am going to do at this point is ask Rebecca to open it up, see if there's any questions about, oh, well, I do want to mention, but Rebecca, you can start opening it. As you've heard in the news, there's a substantial amount of money coming from the feds for SNAP and WIC, a lot of money. And you will, I just looked at the draft bill. The House made some technical changes, so it's going to the Senate this afternoon. So that is going to also increase the monies that people are going to be able to spend, and it's really going to be targeted to people that may have lost their job or that type of thing. This bill also at the federal level deals with paid sick leave and paid family and medical leave, and it gives a tax credit to employers that have to pay for that. So our question back to the federal associations is, but we already have 2 weeks paid sick leave, and we already have paid family and medical leave. So
Yeah, it's just coffee.
So we are waiting for some direction on that as to how that will interface. But I did learn that the 2 weeks sick leave will be in addition to any other sick leave and is only to be used by people that have to stay home with their children related to the virus, and the paid family and medical leave also. Tammy Hetrick in our office is going to be the lead on making sure we get that all interpreted properly, because she is on the state advisory committee on paid family medical leave and works on sick leave. So she's going to be interfacing nationally to make sure we've got exact instructions for you all. But we have been told this is going to be over and above what our state already has, and it's likely that the tax credit is only going to apply to the new benefits. So I'm sorry I missed that. So within the next 48 hours, we should have a lot of information for you on SNAP and WIC, and also on the sick leave and paid family medical leave. And Tammy, I hope you are unmuted at this point in time. Is there anything that we need to add in on the sick leave and paid family medical leave?
No, I think you've covered it. We've reached out to our local agency. We have a meeting on Friday, an advisory committee meeting, and we hope that we've heard from the Senate by then and have a better idea of, how to approach this. We want to make sure that we can find ways to keep this as financially reasonable for employers as possible, since we do have a program. So more to come, definitely, as we work through this.
This morning also, the pharmacy board had teleconferencing discussion and did some special waivers and exemptions on PPE equipment for our pharmacies, and we'll be getting a written document on that, I would think, hopefully by tomorrow, if not by the end of today. So you can see the state and the federal agencies are all responding to our needs. And Melissa Burgess from our office, who is managing this website of information, is going to see if she can get a tab put up there for you to ask a question, and then we as staff will all make sure we jump right on those questions and respond to you. And if one of our members see the question and has an idea, they can respond to you. So we're going to try to get that set up for this unusual time. Okay, I think I've exhausted your brain on all this stuff. Are there any questions on the stuff we just covered?
So Jan, this is Rebecca. When I went to unmute people, most people are not self-muted, which created too much background noise. So currently I still have everyone muted.
Okay, so would everybody mute their own telephone, please? now, and we're going to unmute everybody, take quick questions, and then I'm going to call on Mike Latham of Town and Country, Amy Simpson of PCC, and Kevin Weatherall from the markets to share some best practices and good ideas that they've been implementing on their own to accommodate the environment we're in. So hopefully everybody's muted on their own telephone. Go for it. Questions?
Hi, this is Brenna Davis with PCC. Thank you so much for having this call. I really appreciate it. I was curious about if you could expand more on the hot bar and salad bar closures. When were you expecting that, and what are you expecting?
Well, they were going to try to have the written document to me before this call. I talked to the Department of Health staff at about 10:30 this morning, and they said, "Oh, Jan, we're going to really try to get it to you." And I'm checking my email, and indeed they have not. But my discussion yesterday with the staff, I talked about sneeze guards. I talked about hot bars killing the virus. I kind of just talked as much as I could, and I wasn't getting warm and fuzzies back. So I really expect that they're going to have us close down any self-serve bars in our stores. That's my guess based on everything I tried to finagle out of them yesterday.
Awesome. Thank you so much.
And I would be ready to do that immediately because it kind of goes along. It's the same as the implementation with closing the restaurants except for to-go food. So it's all wrapped up in that same executive order. Other questions?
Hi, this is Amy Simpson from PCC. I just wanted to follow up on the federal level Families First Corona Response Act. And it was our understanding, and we confirmed this with another trade association, that there was actually wording that for the 2-week additional, that was only applicable to between basically 50 and 500 employee businesses. Is that not the case?
Amy, you are correct, and thank you for that. It is only, well, it's in the bill, it says 500 and below,
Right.
But yeah, so you are absolutely correct. I know that there are a number of the federal associations that represent smaller businesses that are up in arms over that provision. But the technical changes from the House just came through about an hour and a half ago, and that provision is still in the bill with no technical change. So thanks for that clarity, Amy. I invite anybody to jump in here and keep me straight because there's just been so much to try to track here.
So Jan, I have some questions from the question box that I can read out if you want.
Please.
Going to level 12 is a huge step. Do you know if grocery stores will be mandated to certain hours, security issues, or any info on how we handle day 1 through 3?
That has not been brought up in terms of hours, but I would not be surprised if they did not have you close down during the late night hours. In fact, I know that that is one of the recommendations, is to close down for complete cleaning and restocking. And I know a number of our stores are doing that anyway because it's hard to really do a deep clean on the store when it's packed full of customers. One of the other recommendations, and it's not a mandate, it's just kind of a recommendation Department of Health asked us to consider yesterday, is that after we do a nighttime deep cleaning and restocking, that we open the stores to senior citizens only for the first hour or two in the morning, so that is limiting any exposure for them. So I cannot say for sure what will be in that, but the staff has not told me that there's going to be a restriction of hours at this time. And yes, it is a huge step. Step 12 is huge, but unfortunately we still getting more and more cases, positive tests.
Okay. Are we telling all our checkers to frequently sanitize the credit debit terminal, keys included?
I hope that you are. This is a big, big concern. The grocery carts, the handles on the grocery carts, and those keypads, huge concern. So I hope that you have already implemented that as a best practice.
What should we be doing to screen employees coming to work?
Well, that's a very good question, and we might have some members here that can jump in and unmute yourself and jump in and make a recommendation, because there are no recommendations from the state at this time.
This is Kevin Woodrow. Can you hear me?
Kevin.
Hi.
You betcha.
Hey, the King County Health Department webpage is better than the state webpage for employer information. So I would go there and look. They have advisories for different types of businesses, including retail that's open. But it's basically the stuff that you've heard. You know, we really want to reinforce with employees, if you're sick, don't come to work. We started doing temperature screenings 2 weeks ago. They're voluntary, but we have 100% of people agreeing to it. We basically put together a little notice that we had them read, and we identified what average temperature is, which there really is no average temperature, but it's 98.6 or something. So if somebody screens on the thermometer, we bought forehead reading thermometers quite a while ago. They're kind of hard to get now, but we told everybody it's better than the other options for temperature checking. But basically, if they come in and they're 95 to 100, we screen them again in 2 hours. And if they're still elevated at a mild temperature, we send them home and we pay them for that whole shift. And then we tell them to take the CDC advice, which is to do a self-diagnosis. And if they're still elevated, not to come to work. So they kind of get a heads up that that's kind of the program for the markets. We had one team member complain to the union. We worked with them. The union on the Seattle side, they deal with hospital staff, and so they're pretty aware and supportive. They spoke to that individual and basically said, you're going to have to do what your employer asks you to do with regard to this. We've had a couple people come in coughing. We reminded them that, hey, when you're not well, you can't come to work. We've sent them home. We did not send them home with pay, because that information has been broadly distributed to the population about and reinforced continuously. If you are not well, don't go to work. And we've really reinforced that. We think the temperature checks are a really good reminder of what the whole program is, with regard to, you know, keeping yourself healthy and following the steps about not touching your face, you know, working real hard at following the protocols to keep yourself healthy. So we do screen, and we've created a high level of awareness. And I'd say 98% of the people that work for us are really thankful that we're taking steps to ensure a safe workplace. We did not want to be the first in the paper to have to send a bunch of people home because we had somebody come in with the virus. We informed them, basically what the issue was with workers having to be quarantined and the impact on income and the impact on the stores. Created that this was a serious and important issue. We did that about 2 weeks ago. So it's kind of the way we roll now with regard to that. So I don't know if you can get those temperature thermometers, but that's what we use. It's very easy. They come to the front end. The store manager is called for a manager check, and they just zap them in the head real quick, and then on they go. We wanted it to be visible to customers because we wanted our customers to feel like we were on top of our game. We want them to feel safe to come to our store and felt that activity in the presence of, the sales floor and the rest of the staff really reinforced that we're working hard to make sure that when you come to our store, it's as safe as possible.
That's excellent, Kevin. Thank you so much. Does anybody else have recommendations for a program you've implemented with your employees? Please just unmute yourself and jump in here. This is a time to share. Make us all better. No? Okay.
Well, I can read more questions if you want.
Sure, and I'll say we do have the CDC recommendations up on our website also. So if you want to refer to those, but thanks, Rebecca, go ahead.
Will you be willing to share the memo you referenced once you get it?
Oh, absolutely. Everything I'm getting is being posted on our website. If you open our webpage, it's right there, the COVID-19, and absolutely, and it will be posted under the state part, the Department of Health, because that's where the information will be coming. But when we get it for the first day, we'll be up on New Today. So absolutely.
And do you know if food banks are going to be in the same category as grocery stores and be allowed to stay open?
Yes, they are. They are included. Any organization that is providing a source of food is going to stay open. Not the senior centers, but they're doing drop-off meals and stuff. So yes.
What should a retailer do if an employee is tested positive for COVID-19?
I can chime in on that.
Yes, go ahead.
We called the health department and asked, because we wanted a better definition about what happens when someone tests positive. What do they do? What do they want us to do? And what is also considered to be close contact? Because we didn't know if somebody came to work, went home feeling poorly, was tested, and they worked around a staff of 10 people, if all 10 people were going to be sidelined for 14 days. Our health department person told us that basically they would want a list of people that worked that day. They would contact them and make a determination on whether or not they needed to be quarantined for the period of time because of too close contact. They said basically 10 minutes, being within close contact, 6 feet or so for more than 10 minutes, or being touched would be a framework that they touched by that employee that had been diagnosed would be considered an issue for them to be quarantined for those 14 days in the sideline. Sorry about that. Once we had that information, we made sure that we spent time with everybody to let them know that, social distancing is important when you're in the community, but also at work, and try to make sure that we're spacing ourselves out and not spending our time too close to each other, so that if in what will be a highly likely scenario, someone who works for us is going to be sidelined. We don't want a whole meat department taken out. So that's what Skagit County Health told us.
Thank you, Kevin. You know, at this time, I just remind people that when you're on a webinar, if you don't log in to the site, onto the website before you call in on your telephone, you're not able to talk. So if you're trying to talk to us and we can't hear you, it's because you did not log in. So just go in and tap on that email, tap onto the website and go in that way, and then call, and then you'll be able to converse back and forth here.
Hi, Jan. This is Jan.
Yeah, go ahead.
Sorry, this is Amy Simpson with PCC, and I just wanted to say that we can't really speak to the detailed experiences of what we went through with one of our stores, but I just wanted to reiterate that what Kevin just said was consistent with the advice that we were given through our procedure.
Perfect. Thanks, Amy. And one of the items that's up on our website under industry best practices was, I thought, a very creative way that Kevin used in his stores to remind his customers and employees about the 6-foot rule. You want to just touch on that real quickly, Kevin, how you do that, and that they can go in and look at it on our website.
Yeah, these are going up today. They just got developed, but we basically, when I was in stores, I was kind of creeped out by how close people were to me. And I'm really hyper aware of that because, you know, I'm older and I do have some conditions that would, if I caught that bugger, I'd fall into the category where it'd be bad for me. So I wanted to have a reminder about what this social distancing idea is and the 6 feet of proximity. So we created a floor cling that's 6 feet long that has the CDE recommended social distance is 6 feet, and it's got a couple graphics on it. And we are putting that on our entry door. We're cutting it in half because our entry doors slide open. So it's going to be something that they see first out as an impression. And then we set up a station as you enter the store where that cling is just beyond the threshold. And there's a sanitation clerk there that's sanitizing the cart handles with the solution that's, you know, you can find the mixture. It's the sanitary solution with bleach. King County has that on their website. And then drying the cart handle, and then there's a Purell stand right there so the customers can sanitize their hand before they go off on their cart. We're also handing them information about curbside pickup and that kind of stuff. So it's, again, trying to create that environment where customers come in, they know that we're on our game, and we're also creating awareness for them to be on their game, so that as these crowds and bubbles of people move through our store, those customers who are hypersensitive about it don't feel really uncomfortable because, you know, somebody parks right next to them at the deli service counter when they could easily park a few feet away and give some more space. I put the same thing in my convenience stores so that, you know, it's a smaller footprint, tighter aisles, but I wanted to create that awareness for customers and team members about keeping separate. So Jan posted that on the WFI website, the PDF of it. You guys, if you want to make your own, that's fine. If you want to use that, that's fine. I think it's, again, trying to create an environment where my employees are on their game and customers know that we are too.
Thanks, Kevin. Amy, do you have some other contributions to make on some things that PCC has done? Amy, you've probably muted yourself like I asked, but we're not hearing you. If I'm asking if you have additional contributions.
Hi, Jan. Sorry about that. Technical difficulty. Yeah, no, unfortunately, as far as, we had kind of discussed if we would be able to talk a little bit more about kind of our experience with one of our stores, but it's just unfortunately because of public health privacy rules and everything like that, we can't really go into much detail on that. And I think that a lot has been covered here as far as what the steps that are all being considered in the stores, as what will work in each situation. I would put a question out there in that we've heard a lot about, I think Costco had started limiting how many people they were doing in the stores, and then kind of letting in, 25 out, 25 in. And curious to anyone else if they've implemented that, or if that's some of the protocols that you're hearing might be in place with this level 12 enactment.
I have not heard that they're going to do that. They did ask me yesterday what I thought about if that were to be implemented, and that's when my response was just have National Guard or local law enforcement at the door to help us until people get used to it, because tempers are already flying with a lot of the customers because we're out of product. So the fact that they asked me about it means that they're thinking about it, but I don't have a clue on that one, where they were headed, leaning. But can anybody answer the question Amy had? Have you implemented that type of strategy at any of your stores? And make sure you unmute yourself if you're going to share so we can hear you.
This is Kevin again. We asked the health department people that we spoke to about that 50-person rule, and at that time they didn't really think it would apply because we already have, in some cases, that many people working there. So they really want to make sure that we're doing a good job of this idea of policing social distance. That was their comment.
Yeah, and just to clarify, that's a good point, Kevin. I'm not speaking to the already existing employees or the limit that was set by the governor on social gatherings. It was more of a best practices that we've heard discussed and know that Costco had done, I believe this last weekend, where the customers coming in was limited to, I think for their space, 1,000, and then they said that until 25 had left, 25 could come in, or, so it was kind of throughout the day, then that was being monitored as far as the total amount of customers allowed in there. And it didn't have any relationship to the governor's or anyone else's mandates as to like social gatherings.
I saw that on TV, the lines outside the store waiting to get in. So I guess they didn't have a brawl or we would have heard about it. So does anybody have any other thing to contribute? I don't know. I think Larry Baker might be on, but one of the issues that has come up the last several days actually with our stores is some of them have had pushback from their employees on reusable bags, not wanting to touch the reusable bags. And then of course we have all these different local ordinances until the state ban takes place in January. And when I was on the phone call with CDC yesterday morning, I asked the question, can the virus be transmitted on a reusable bag? Because they've been talking now that they believe the virus can be transmitted on a hard surface, but it's still one of those question marks out there, but they're leaning toward that, and it can last for 2 hours up to several days. And they said they didn't know that yet, if it could be transmitted. So I've just told our stores, do what you think is right, and I don't think the bag police is going to come find you. They have bigger issues to deal with right now, and I did send an email to the lead legislators that worked so hard on the bag ban last session and to the environmental groups, just letting them know that under the circumstances we're telling our members to do what they believe is the right thing for their customers, their employees, and so that's where we're at on the bag. So I just wanted to let y'all know, because that, funny enough, that was the #1 call I was getting from our members about the reusable bags. So Larry, I don't know if you have something to add in there.
Kevin again.
Oh, Kevin,
Yeah.
okay.
Sorry to butt in all this time, but we have all of our staff.
Kevin, you faded out on us.
Are you, am I?
Come back to us.
Hello? I'm here.
Yeah, okay, there you are.
We had, 2 weeks ago, we started having all of our staff wear gloves. Primarily, when we sat down, we talked to them about how this virus is transmitted. How would they get it? It's going to come in through your airway or your eyes, usually by touching your face after you've had a contact with, a surface that has the virus on it. So as a precaution and to try to get ourselves to not touch our face, we felt like wearing gloves would be a good idea. And we have complete acceptance on that, because after about a half an hour on the check stand handling money and you look at those gloves, you realize that that stuff was getting on your face before when you were touching it. So we have gloves, frequent change. We've taught them how to change the gloves safely. And customers have commented about it, that they appreciate that we're doing that. So we're, that's our way of trying to minimize staff from, picking this bug up, is trying to keep them from touching it in the first place and then putting it on their face somehow.
Excellent. Yeah, excellent. Anybody else want to jump in here? Are there any
questions?
Okay, go ahead.
What is the source of your information that Washington is moving to a stage 12? That information has been passed around for many days now, and Governor Inslee himself discredited that information via Twitter, saying there has been no discussion of quarantining Washington state or banning travel.
The apps, I was going to say that the quarantine, like Northern Italy, is level 13. And that is not being discussed. Where did I get the information? And again, I'm telling you that that the staff didn't say it was for certain, and it isn't in writing. But I was told that there would be a press conference tomorrow with a new announcement. And I myself said, does that indicate that we're going to move to level 12? And the staff made it sound very likely that that was going to be necessary because of the frequency again of the incidences. So yeah, so that's why I cautioned you at the very beginning that the staff didn't say it was going to happen. They just said there's a press conference tomorrow with a new announcement. So I just give that to you with a grain of salt.
Okay. Oh, someone asked where that PDF that Kevin just referenced, where on the website is it?
If you go to our website, when you very first open it, it is the COVID site there. And I know Melissa's on here. There's a box down toward, we have it all in different boxes, and there's a box down, what does that say, Melissa? WFIA member resources or something of that sort. Melissa, you are probably muted.
Is it here? Can you see the screen, Jan?
Now I cannot. Oh, here.
Yeah,
Okay.
it's there.
Move down. Move.
Is it this distance floor cling?
No.
No.
Oh, maybe it is.
Yep. Yes, that's it.
Yes, it is. Okay. There it is. Can you pull that up?
Yes.
It's quite eye-catching.
Sorry. I had something else up.
No,
That's not it. Oh, that's the salad bar sign. I don't know why it pulled that up.
Yeah. So but it is in that member best practices there. Let's see the markets.
No.
We'll double check that because I know we've got it. So
It looks like you have it linked wrong.
yeah, I think so.
Yeah.
So we will get that corrected right away, and it will be under the Markets LLC, and we'll get it right there. So Melissa's listening to all this, and she has the document. So knowing how fast she works, I wouldn't be surprised if it's changed by the time we hung up.
And feel free, if you want to use any of that stuff, you don't need my permission, just grab it and use it.
Great. So more questions. Sorry, I'm just pulling it back up. Kings Market and Marketplace in Friday Harbor has installed plexiglass barriers between customers and clerks. So that's one of their best practices.
Interesting.
How long would, any idea how long a level 12 might be in place?
I don't think any of us know any of this stuff right now because this is our first experience with this, and I think it's kind of taken us all by surprise how fast it's moved, and it's a new virus, so I wouldn't dare to guess. We just have no idea what's going to happen, but the only thing we are certain of that CDC said they're certain of is the social distancing is the trick. So I think that's a huge focus for our stores, and keeping those cart handles clean and the checkout stands and keyboards.
Has any company thought about how to handle security yet? We all need a good plan. A consistent plan would help all of us. Anything that can be shared that is developed yet?
Good question. Anybody? Well, that's a good question, a good one for us to work on. So security plan, can you expand on that a little bit more in terms of, are you talking about security plan in terms of making sure people are social distancing, or are you thinking about limiting the number of people in your store, or what is it that you're really thinking about? Or people fighting over a roll of paper towels?
Tyler, you're unmuted, so you should be able to talk.
So I guess that's a good question, and we'll put it up on our website to see if we can get some input from some of our members on that, because that's excellent. But if you could give us a little more explanation on that, it would be helpful too to zero in. Okay, any other questions, Rebecca?
No.
Okay, and we didn't get expansion on the security question. So my phone number and my email are up on that website for easy access. So if you think of something after work, now I'm going to ask, does anybody have anything else to contribute to us to help each other with best practices?
Oh,
Okay.
sorry, there is one more. Does the level 12 affect office workers?
You know, I do not even want to get into the details of that because I didn't ask it. I only asked about our grocery stores, our pharmacies, our warehouses, our trucks. I know in one state where they were limiting the number of people in an environment, they forgot to exempt the food processors and manufacturers. So that was a discussion I had this morning with our State Department of Ag, and they said no, they were well aware of that. So I have totally stayed focused on our grocery stores delivery of food. I know you have admin staff, but I've not ventured there, and the fact that the governor has not made an announcement on anything firmly, I'm sure his staff does not want to get out in front of him. If he's like Trump, he would not like that at all. So I think right now we just don't have that detail. Anything else? It is coming up on an hour, and this has been very productive. And I appreciate your participation. We maxed out on our number of people we could have, and we will have this recorded and posted up on our website. If you want to have any of your other employees listen to it, it should be up by early tomorrow morning. Rebecca, you'll be working on that. And don't forget, you have a WFIA staff that you are our priority, and we will go to work for you on anything and everything that you need. And we're going to keep walking side by side with you to get through this. So I appreciate everybody's participation. Send in your ideas, send in your questions. Thank you so very much.
Thanks, Jan.
Thank you, Jan, very much. Great call.
And the link is fixed for everyone. Melissa fixed the link. So you can go and look at that.
Okay, thank you.